we are going to see the autonomic plexuses in the posterior abdominal wall. Before that, we should know what are the lumbar splanchnic nerves. So this is the right lumbar sympathetic trunk. You can see the left lumbar sympathetic trunk over this region. This is the first lumbar sympathetic ganglion, second lumbar ganglion, third lumbar sympathetic ganglion, and behind there is the fourth sympathetic ganglion. The medial branches of this sympathetic ganglion form the lumbar splanchnic nerves. They convey preganglionic, motor and viscerosensory, that is pain fibers. Medial branches means these branches. These are the medial branches. These are the medial branches of first. These are the medial branches of second lumbar ganglion. This is the medial branch of third lumbar ganglion, and these are the medial branches of the fourth lumbar ganglion. The first lumbar splanchnic nerve. For a better understanding, I will tell the position of the plexus now. This is the abdominal aorta, which is very much visible over here, dividing into common iliac arteries. Around the abdominal aorta and the upper part, this much region will be the position of the coeliac plexus. Clear? This much region will be the position of coeliac plexus. Around the inferior mesenteric artery, the plexus will be known as the inferior mesenteric plexus. So in between them, this region will be the intermesenteric plexus. Now we will see one by one the lumbar splanchnic nerves. The first lumbar splanchnic nerve, that is the fibers arising from the first lumbar ganglion, pass medially and join with the, you can very well see, join with the coeliac plexus and the upper part of the intermesenteric plexus. The second lumbar sympathetic ganglion, they give splanchnic branches to the, this is the branch which is passing to the lower part of the intermesenteric plexus. This is the lower part of the intermesenteric plexus. So this is the third ganglion. It gives splanchnic branches to the in front of the common iliac artery, this region, and it gives joints to form the superior hypogastric plexus, common iliac vessels, and joins to form the superior hypogastric plexus, which is present over this region. This is the superior hypogastric plexus, and third lumbar splanchnic nerve passes through this region and reaches here. The fourth lumbar splanchnic nerve, that is arising from the ganglion over this posterior to the inferior vena cava, that will be passing posterior to the common iliac vessels and joins with the lower part of the superior hypogastric plexus. Now we will see the autonomic plexus in the posterior abdominal wall. The principal prevertebral autonomic plexuses lie in front of the abdominal aorta, and they provide secondary extensions around the coeliac trunk, the superior mesenteric arteries, and the inferior mesenteric arteries. They are formed by the thoracic and lumbar splanchnic nerves, branches of both the vagus nerves, and are intermingled with the masses of ganglion cells, which act as postganglionic sympathetic neurons. These plexuses convey the pre- and postganglionic sympathetic fibers, the preganglionic parasympathetic fibers, and sensory fibers. Mainly three primary plexuses deserve special mention in the abdominal proper region. That is the coeliac plexus, we have already seen. Then the intermesenteric plexus over this region, the inferior mesenteric plexus over this region, and the superior hypogastric plexus. The superior hypogastric plexus is rather pelvic. than in the proper abdomen. So we will see one by one. First one, the coeliac plexus, which is lying around this region. It is otherwise known as solar plexus. It consists of dense network of fibers around the origin of the coeliac trunk and the superior mesenteric artery, both arteries. Now it contains a pair of coeliac ganglia. You can see a pair of coeliac ganglia, one and another one over here, a right and left pair. Then superior mesenteric ganglion, which is lying in the middle lane, just above the origin of the superior mesenteric artery. Then you have the a few detached right and left aortico-renal ganglion. These are the aortico-renal ganglia. The right and left coeliac ganglia, they are situated correspondingly in front of the corresponding crus of the diaphragm. The right ganglion lies behind this is the right ganglion that lies behind the inferior vena cava, and the left ganglion that lies behind the splenic vessels. These aforesaid ganglia of coeliac plexus are connected with the greater and lesser splanchnic nerves. That means you can see the nerves piercing the diaphragm and reaching the plexus. This is the greater splanchnic nerve. This is the lesser splanchnic nerve, right side. And here also you can see the greater splanchnic nerve, the lesser splanchnic nerve. Now what are these? These are passing along through the esophageal hiatus, and these nerves are known as the anterior and posterior vagal trunks. So they all everything forms the coeliac plexus. Branches from the coeliac plexus extend along the arteries and form the following secondary plexuses. So what are the branches from this part of the aorta? They are phrenic plexus, hepatic plexus, gastric plexus, splenic plexus, superior mesenteric plexus, renal and suprarenal plexuses. Next we will see the second one, that is the intermesenteric plexus. This intermesenteric plexus does not contain any ganglion. It extends as a downward continuation of the coeliac plexus and intervenes between superior and inferior mesenteric arteries. This is the inferior mesenteric artery, this is the superior mesenteric artery. So this region will be the intermesenteric plexus. Now this plexus receives contribution from the lumbar splanchnic nerves. We have already seen the upper part will be receiving contribution from the first lumbar splanchnic nerve, lower part will be receiving contribution from the second lumbar splanchnic nerve, and provide a downward, this intermesenteric plexus provide a downward extension which joins with the, you can very well see the downward extension which joins with the superior hypogastric plexus of this region, the pelvis. Lastly, we will see the inferior mesenteric plexus. The inferior mesenteric plexus is derived from the intermesenteric plexus. You can see the intermesenteric plexus over this region. It is going to give rise to the inferior mesenteric plexus around the inferior mesenteric artery. This plexus conveys essentially sympathetic fibers to the left 1/3 of the transverse colon, descending and sigmoid colon, rectum and anal canal. The parasympathetic fibers for the distal part of the colon, they are derived independently from the ascending branches of the pelvic splanchnic nerves, which are arising from the S2, S3, S4 segments. These are all about the main features about the autonomic plexus of the abdomen.